think what's most challenging to the patient is understanding where in that spectrum they can get the best care.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
What makes us a bit unique is we also operate a level 1 trauma center in Youngstown. So we have the most acute of the acute emergency visits presenting there from a broad geography of facilities that refer into it. The day-to-day experience in an emergency department, even a level 1 trauma center, is generally associated with evaluating patients, treating them, and discharging them to home. It's the unusual case in many instances, or for sure the less common route for those patients to be admitted to a hospital. Now, at a facility like St. Elizabeth Youngstown Hospital, that is a level 1 trauma center, our percentage of admissions is greater than at a community hospital. So to Dr. Musali's point, at a level 1 trauma center, that's actually the case. In a community hospital, the percentage of people being admitted is often in the teens in terms of the total number of visits that they see on a daily basis. So the importance of that in a general community hospital is not as great. And we see the same thing in a freestanding emergency department like Austintown. Emergency medicine residency trained physicians need to utilize the maximal level of their skill on a very, very small percentage of emergency department patients. So the vast majority of patients who present to an emergency department are not in life and death situations, but they're there because they're having a medical problem that can't be addressed as they see in the community. Some of the common things that present to the emergency department that might surprise the general public are things like low back pain and dental pain, non-fracture related orthopedic injuries, such as sprains and strains. And it's very common for people to present with symptoms and not necessarily leave with a diagnosis. So they might present with nausea and vomiting and diarrhea. And we can control their symptoms in an emergency department, but oftentimes those people don't need anything other than symptom control. So it's interesting because the health systems across the country have seen that since COVID began, there's been a dramatic decrease in emergency department volume. In general, there hasn't been an increase in mortality in the community. So when you stop and think about that, it actually aligns very much with what emergency physicians have seen over the course of the past several decades, is that many of the people that present for emergency care can have their symptoms managed someplace else. Or if those symptoms are mild enough, they may go away on their own and not need to be managed medically at all. So what we're seeing now in emergency departments are people who are increasingly sick or ill, and people are making that decision very, very effectively to determine when they need that higher level of care. Now, there was a lot of concern early in the pandemic, particularly in the first surge of the pandemic, about people avoiding emergency departments, and that's the last thing we want to have happen. We never want someone with chest pain or stroke-like symptoms to not seek emergent care. And that was a big concern. We've seen that moderate, we think. We think that people are making better decisions now. And we tend to see a normal rate of those things now, as compared to maybe the first surge in the spring of 2020. But again, that's always a bit of a concern, being sure that those are truly ill continue to present to the appropriate location.
Thanks for watching the video. Be sure to like, subscribe, and hit that little bell for notifications. And also make sure to connect with us on Twitter, Facebook, and LinkedIn. For all of your business news, visit BusinessJournalDaily.com. For all of your arts and entertainment news, go to AfterHoursYoungstown.com.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
I like a bank that's a pillar in my community.
I like a bank so cutting edge, they have a lab branch.
We are so alike.
Well, we do both bank at Farmers National Bank.
Farmers.
Stand strong.